When assessing and treating a patient who has a VAD, follow your standard protocols for primary and secondary assessment and for managing immediate life threats.
When you're assessing a patient with a VAD, you want to make sure that all the components of the VAD itself that are outside the body are also functioning appropriately. The patient will have a battery pack that operates a VAD. You want to make sure that those batteries are fully charged and or the device is plugged in itself. You want to make sure that the device is on and running, and you want to make sure that there is no kinks in the drive line that enters the patient's body. The patient will have the drive line enter their body in and around the lower part of the abdomen, and you want to make sure that that site itself is clean, dry, and free from infection.
Proceed with caution to avoid disturbing the device. Do not pull on cables or attempt to remove battery packs. Keep all device components within reach of the patient. The presence of a VAD affects certain vital sign measurements, so be aware of these differences as you gather information.
So a VAD works by providing a continuous mean arterial pressure, or MAP. The MAP essentially is what's needed to perfuse the distal tissues of the body, the organs, brain, kidneys, etc.
Because a VAD delivers continuous flow and a constant mean arterial pressure, blood pressure may not be measurable.
Because a patient doesn't have a beat-by-beat blood pressure, they will not have a systolic or diastolic pressure, which is also needed to feel a pulse.
A pulse oximetry reading for a VAD patient may be inaccurate, as these devices typically rely on a pulse wave to gather SpO2 levels.
When we use a pulse oximeter, we validate that score by the waveform on the pulse oximeter itself. That waveform is captured by the pulse pressure and the beat-by-beat systolic and diastolic. Because a patient with a VAD does not have a systolic and diastolic or beat-by-beat pressure, the pulse oximetry reading that you get will probably be inaccurate or not obtainable at all. What you need to do then is actually look at the patient and decide whether their skin tissue is perfusing appropriately. Is the patient pale? Are they sweaty? Is there area of cyanosis around the lips or fingertips? And that would all indicate that the patient is not receiving appropriate oxygenation to those extremities or the rest of the body, and you may need to provide supplemental oxygen.
Consider whether inadequate circulation may be affecting the patient's level of consciousness.
If the patient is receiving an appropriate continuous mean arterial pressure, then we know it's perfusing the distal organs of the body. One of those organs is obviously the brain. If the brain is not receiving an appropriate mean arterial pressure, or MAP, then the patient may have a change or decreased mental status or be unresponsive altogether.
When assessing for lung sounds, you may hear a whirling or humming. This indicates that the VAD is working. Listen for sounds associated with fluid overload.
So it is possible to auscultate the machine while you're assessing the patient's lung sounds. The patient might have rails or crackles in their lungs if the VAD is functioning inappropriately. But in a patient who's breathing normally, you might actually hear the device itself operating in the background.
When assessing a patient with a VAD, especially one who has recently had the surgery, look for signs of infection or sepsis, such as fever or tachycardia. An infection at the site of a VAD lead or unrelated to the VAD can result in fluid loss. This can negatively affect a patient. Even though the device may be operating, the low fluid volume impacts cardiac output.
A VAD patient may also have an ICD, or internal cardiac defibrillator. This device is separate from the VAD itself and provides an electrical shock to the patient should they go into a lethal dysrhythmia like ventricular tachycardia.
An ICD may include a pacemaker, enabling normal heart function with regular electrical impulses. Failure of an ICD or pacemaker device would be a priority over VAD-specific complications. Regardless of the patient's chief complaint, EMS providers should consult with the patient's family and caregivers, who should be knowledgeable on the device. The patient or caregiver should provide a card with contact information for the VAD coordinator. A VAD coordinator is a professional who can answer questions about a patient's device and give direction to EMS providers. It may be best to keep a VAD coordinator on call throughout your assessment and treatment.